My name is Erin Strife. I'm the Director of Healthcare Services for the Clinton County Health Department. I'm going to start with our numbers. We are at 57 confirmed cases, 3 probable, and 42 suspect. That brings us to 102 total cases. Of those, 82 have recovered, 16 are active cases, and 4 have died. We've been seeing that our physical distancing is working, and I want to tell you thank you from the bottom of my heart. By far, the vast majority of America has been coming together in unity to protect each other and do what is right for the greater good. But it has not been easy, and it has come at a cost. The cost of physical distancing has absolutely been lower than the even larger toll we would have seen in sickness and in death had we all not taken these measures. But it has been difficult, both emotionally and financially, for all of us. Your sacrifice for your community is working. Continue to stay the course. We as a state continue to be on pause until May 15th. Non-essential businesses remain closed. Gatherings of any size are postponed or canceled. We're not spending time together in groups. We're staying 6 feet apart. We're wearing face coverings. My expectation is that on May 15th, we will look at softening these practices. I'm going to be direct with you about my opinion on what our future is going to look like. I do not expect this virus to be eradicated, at least not anytime soon. I expect that it will continue to circulate like so many other communicable diseases we public health nurses fight to contain on a regular basis, like measles, like pertussis. I do not think that our lives will always be as they are now, having birthday parties where we drive by each other's houses and wave from a distance. But we need to be realistic about maintaining the standards of infection prevention we've come to adopt as regular practice. We need to stay home when we're sick, and when we find out we've been exposed to a sick person, we need to be extra careful to avoid contact with others until we're sure that we haven't been infected ourselves. We still need to wear masks and stay 6 feet apart. Implementing containment measures is our new normal for some time to come. I just want to speak to a few trends we've been seeing in terms of questions and comments. Remember, if you can safely leave your children at home while you do grocery shopping or run errands with an adult or a responsible older child, please do so. I understand that's not always possible, and I do want to point out to everyone, because I have been in this position myself where I've had to bring my son with me to a grocery store or somewhere else because I didn't have an alternative childcare arrangement. Sometimes we do the best we can, and it's not ideal or perfect. Also, just a quick review, the number of people we have on quarantine is not the same as the number of active cases or even total cases. So active cases go on isolation, and that isolation period lasts at least, well, they're symptomatic, so it's 7 days from onset of symptoms minimally, plus 3 days or 72 hours with no fever without the use of fever-reducing medication, plus symptoms have to be mostly resolved. So that is an active case placed on isolation. Quarantine is for 14 days from the last date of exposure. And those are people who do not have symptoms, but who have come in contact with a sick person. And the reason for 14 days is that's how long it takes for us to be reasonably certain that the exposed person is not going to develop symptoms, or they'll develop symptoms within that time frame. Sometimes this comes up in terms of who gets quarantined, and we've been taking a few different approaches to this. For the most part, we identify close contacts, but there have been situations, for example, in congregate living facilities, where it's not always possible to know who a person has been in direct contact with, or if that person has potentially exposed other people even if they weren't in necessarily very close contact with that person. And again, that's why we have these blanket statements asking everyone to continue with the physical distancing and the mask wearing and the hand hygiene, all of those practices. I want to say I also hear you on wanting more testing. I'm absolutely with you on that. We have requested supplies from the state, and we're not getting the number of supplies we've been asking for because they don't have as many supplies as they need either, and hard decisions are being made about allocation. We continue to push for the resources that we need to care for our community. Our community's actions have made me so proud. I am so proud to be a resident of the North Country. We are helping each other buy groceries, we're making each other face masks, we're facing this challenge head on, doing what we need to do with the resources that we have. You guys are amazing, and I'm so glad to be a part of this community. Thank you for what you continue to do.